Have you been struggling with hypothyroid, but also have gut symptoms that you can't seem to get rid of? Many just like you have tried treating the thyroid with no improvement. Others have focused on the gut only to find the same frustration and relapses occurring. This all happens because no one has informed you of the mistakes that you've been making. Wouldn't it be nice to know what those mistakes are so you don't make them and you can find permanent resolution? Hypothyroidism and SIBO, also known as small intestinal bacterial overgrowth, often occur together. This is well known, however, it's often approached in a way that doesn't create resolution. Isn't it frustrating to know that despite your best efforts to address this situation, your health continues to decline? Well, with that in mind, I want to share with you 6 common mistakes that are leading to you not finding resolution and share with you how to avoid them. But before I do, allow me to introduce myself. I'm Dr. Arland Hill, and for the last 20 years, I've been helping first-time and recurrent SIBO sufferers find resolution by focusing on all 3 phases of the condition to resolve symptoms in a timely manner. When we confront mistakes, it often leads to progress. If you want to see progress, let's turn your previous mistakes into solutions. And the first mistake that very often occurs when dealing with SIBO and hypothyroidism at the same time is just treating SIBO. When you focus on the overgrowth only, it's missing the bigger picture of what's going on with SIBO. In fact, even when we're only talking about SIBO and not in the context of hypothyroidism, the biggest mistake that is often made when it comes to SIBO is only focusing on the overgrowth, only trying to bring that overgrowth back under control and not dealing with any of the things that allowed for the onset of that overgrowth in the first place. And one of those that rises to the top of the list is motility, specifically motility of the bowels. If your bowel function is slow, there's a much higher probability that you're going to have SIBO. So from the time you ingest food until the time you eliminate that, if that is too long a period of time, that's a slow bowel motility. And what that means is that you're not eliminating and moving the contents through the gastrointestinal tract as fast as they should be, and things aren't moving out of the small intestine into the large intestine like they should be either. Well, it turns out hypothyroidism is highly correlated to constipation. And another way of saying slow bowel motility is simply constipation. There's different frameworks that we can look at for constipation in terms of how it actually manifests or what the characteristics of it are, but it often sets the stage for a relapse of the overgrowth. So again, if you're not moving the contents out of the small intestine fast enough into the large intestine within the time frame that it should occur, then ultimately what's going to happen is those organisms continue to stay in the small intestine, they begin to overpopulate it, and now we are on the trend towards an overgrowth in the small intestine. So this mistake number 1 here is simply focusing on SIBO, only treating SIBO and not acknowledging the role that the thyroid has to play in motility. Now, what about mistake number 2? Well, mistake number 2 is almost the exact opposite. It's just treating the hypothyroidism. Normal thyroid physiology dictates the speed at which things occur throughout our body. Many would think about this as your normal metabolic rate. So when your thyroid function is declined, you're ultimately seeing a slower motility, not just in the bowels, but in other tissues as well throughout the body and almost every other system throughout the body. But the problem with this is that it minimizes the overall function of the gut. There's literal receptors in your gut that respond to thyroid. So if those thyroid receptors aren't being stimulated with adequate amounts of thyroid, then the gut's not going to repair efficiently, which also means that the communication that occurs between the microorganisms in the gut, and the nervous system, that's also going to be potentially affected as well. The gut plays a very pivotal role in working with the thyroid, and even to the point that it allows the active production of thyroid hormone. A percentage of our active thyroid hormone is generated in the gastrointestinal tract. So if we're only looking at the thyroid, we're not giving consideration to the role that the gastrointestinal tract is playing in helping maintain and optimize the thyroid function. And the problem with this is that it leads to an imbalance of the microorganisms in the gut. That is ultimately going to transition into inflammation, which you experience as symptoms. And then from that, you're going to see further progression, if it goes unchecked, into immune reactions. And these immune reactions don't stay local in the gastrointestinal tract, they start to go throughout the body. And where this really begins to go full circle is when we start to talk about Hashimoto's thyroiditis, the autoimmune response. So this breakdown in the integrity of the GI tract can open the door for the dysfunction at the thyroid. So problem number 2 here is just treating the thyroid. And you'll see, right as we've only looked at this first 2 of the 6 mistakes that I have for you, if you are dealing with both of these at the same time and you're only focusing on one or the other and not giving consideration to both, that probably is the reason you're failing right there. But there's 4 other considerations that you need to be making as well. So let me go through those also. The third mistake that's very common is not associating hypothyroid with low digestive secretions. The thyroid does not just impact the motility of the bowels. It doesn't just set the stage for constipation. Remember, the thyroid is having impact on metabolic function throughout the body. So that means that it's also going to play a role with your digestive secretions. So for example, the acid that's produced in the stomach, the enzymes that are produced from the pancreas, the bile that's produced from the liver gallbladder, those are also going to have a role in offsetting SIBO. In fact, those are the core reasons that SIBO begins to propagate. SIBO at its core, while it is an overgrowth, that is not the core of the dysfunction. The dysfunction of SIBO is slow motility and lack of adequate digestive secretions. Here's where the thyroid comes in, because if the thyroid activity is low, hypothyroid, then ultimately you're not going to get adequate stimulation to produce the acid, the enzymes, and the bile that are going to create the defense lines that are going to reduce the bacterial load that are coming from through the mouth, down the esophagus, into the stomach, into the small intestine. You're going to allow that bacterial overload to persist because you're not adequately producing enough of those digestive secretions. That is a byproduct of hypothyroid. And if you're only focusing on the hypothyroid, you're not giving consideration to the impact that those digestive secretions are ultimately having in the manifestation of SIBO. So that's the third mistake. Well, what's number 4? Number 4 is thinking that just a thyroid medication is going to fix the issue. That's not the case here, because again, that's only focusing on one aspect of the overall dysfunction that you're experiencing. A thyroid medication there's a couple of things here. So one, a thyroid medication is only focusing on one aspect, but the other thing that we know too is that, and this may be actually the bigger point, is that when you have these overgrowths in the small intestine, those organisms that are overgrowing affect how you're using the medication. So the dose of the medication that you're using may not actually translate to the amount of the medication that you're getting into the body and how it's benefiting you. So you don't get the full benefit of the medication. But here's the other consideration, and many of you, if you've been dealing with SIBO for any length of time, or if you've experienced the relapse effect of SIBO, the waxing and waning, it improves, it comes back, it improves, it comes back. If you've been experiencing that, then understand that up and down you're experiencing, as that relates to the thyroid, it's going to make your dosing for thyroid medication erratic as well, because those microorganisms are actually in part metabolizing that medication. So if you've had trouble dialing in the dose on your medication, so to say, this could be a large reason why you're having trouble dialing in that dose. And ultimately what that means is that there are going to be times when your thyroid function is still hypothyroid and it's still pushing you back towards dysfunction that leads to SIBO. So the point here is that on this mistake is that, again, you want to look at these at the same time. And by doing that, you're addressing the overgrowth that's making the erratic dosing of your thyroid medication problematic. So we can resolve that. Well, what's mistake number 5? Well, mistake number 5 is going to be using an incomplete assessment to understand the thyroid. So here's what I mean by that. Many times when we look at, when I've seen, often when I have patients bring me thyroid work to look at that they've had done elsewhere, many times what that thyroid assessment boils down to is a TSH, so the hormone that's produced in the pituitary that stimulates the thyroid gland, and maybe, sometimes it's just a TSH, but maybe there's also a total T4 in there, which is the primary thyroid hormone that's produced from the gland. It's not the only thyroid hormone that's produced from the gland, but it's the primary. It's the one that's produced in the greatest quantity. But this is only a snapshot of what's going on. It doesn't give you a complete picture of how thyroid hormone is being metabolized, how that thyroid hormone is interacting with other hormones. So a more complete assessment, and this may not ultimately be complete for everybody. Some individuals may need more than what I'm getting ready to say, but at least you should be looking at a TSH, so your thyroid stimulating hormone, your thyroxine, which is your T4, your triiodothyronine, which is your T3, and those can both, T4 and T3 can both be looked at in what are considered total and free fractions. We want both of those. We want the total and the free fractions to understand the complete picture here. But that's not it. We also want reverse T3. We want the thyroid antibodies. The thyroglobulin antibody is one that we often look at here, but the thyroid antibodies are important to this conversation as well. The thyroid peroxidase, the TPO antibodies, that can all, if those are elevated, that changes the nature of how we want to consider focusing on the thyroid. But unless these are all looked at, you don't have a real understanding of where to intervene for the thyroid. But there's one other aspect of this that I also want to note when it comes to assessing the thyroid is that you, as the individual with hypothyroidism, should be a reflection of the dysfunction of your condition. So what that means is that someone should look at you and do a physical observation with you. You should look in the mirror and actually see, do I have thinning of my lateral eyebrows? Do I have teeth marks on the outside portion of my tongue, lateral scalloping of the tongue? Do you have slow reflexes? That's something a practitioner would look at and check with you. You know, again, is your hair falling out? I mean, these are all things, indications of hypothyroidism. The looking at the eyes and having a change in the appearance of the eyes. This can be another indication for hypothyroidism. So that, in combination with the labs, should give an idea of how to deal with the hypothyroidism and not only looking at just the TSH and or T4. Now, let me ask you something. Are you finding this information useful? Well, if you are, please help me get this information out to others so they can stop suffering as well. And you can do that by hitting that like and subscribe button right now for us. Now, as we go on to mistake number 6, this is almost going to be the opposite of mistake number 5, or it's going to be similar, but in the SIBO category instead of the thyroid category. That's probably a better way to say that. So if you are over relying on breath testing when hypomotility is a much better indicator for dysfunction in your gut, then you're probably going to be led down the wrong track, because breath tests very clearly are not a great assessment methodology. They're okay, but you have to understand that they are fraught with limitations. They have a lot of limitations. And unless you know what those limitations are and how to look through those limitations, the probability is that you're not getting complete resolution on the SIBO, which is further exacerbating the thyroid issue, which in turn exacerbates the SIBO. So they start playing off of each other. To be frank with you, if you're dealing with hypomotility, remember, hypomotility, slow bowel motility, is going to lead to SIBO. That is an absolute given. And so you want to focus on not on the breath test, but on the motility of your bowels. That should be a primary indicator for you. If that is not consistent, if you're not having routine bowel movements, not feeling like you're completely eliminating your bowels are moving too slow. You're going towards constipation, if not already overtly dealing with it. So mistake number 6 is overly relying on breath testing when hypomotility may be an actual better indicator of your problem. Now, those are the mistakes, but remember, we need to talk about what the solution is here. And the solution is very, very straightforward. It is, do not focus on just hypothyroidism or just SIBO independently. You need to look at both of these at the exact same time. And only when you look at these at the same time should you expect resolution of your hypothyroidism combined with SIBO dysfunction. Now, I realize that you may still have some confusion about SIBO, about hypothyroidism. It's only logical looking at what I've shared with you. It can start to feel like a complex conversation. But here's a video that can help you turn your confusion into clarity in 3 simple steps.